are Sint Maarten. You are Sint Maarten.
The URSM, the Unified Resilient Sint Maarten Movement, being a political movement, will be hosting a weekly radio program called You Are Sint Maarten, every Wednesday from 6 to 7 p.m. on Radio Mix 94.7 FM. I myself, Dr. Mercelina, the political leader of URSM, will be hosting this radio program in which current issues, actualities and general topics will be discussed with the people of Sint Maarten. So join us every Wednesday on Radio Mix 94.7 for our radio show You Are Sint Maarten.
You are Sint Maarten. You are Sint Maarten.
Dear people of Sint Maarten, good evening. Welcome to your radio program You Are Sint Maarten on Radio Mix 94.7 FM. As usual, I myself, Dr. Mercelina, will be your host in this weekly radio program. As you know, I'm the surgeon in Sint Maarten Medical Center, and as of 10/10/2021, I am the political leader of the URSM, the Unified Resilient Sint Maarten Movement, that will contest the upcoming parliamentary elections for country Sint Maarten. The URSM wants to do it different than all the previous political parties that have competed and been part of the elections of country Sint Maarten. We do not want to be a political party of bashing, of criticizing, of throwing with mud. We don't want to have the crap mentality, no, because we do believe independent of political party. If it's a good project, a good initiative, a good law, I think it should be honored independent from political color. We do believe that we have to present our package of vision for Sint Maarten in a way that people understand what this URSM is all about and what this URSM wants for country Sint Maarten. We can criticize, but in a constructive way, but immediately after criticizing or describing a reality in our community, we do believe that the URSM is a party that wants to bring also solutions, proposals to correct the errors and the insufficiencies of our community. We do believe that we have to have a populace that is well informed about current issues and also about community developments. Hence today I decided not to have a guest with me, but as Dr. Mercelina, I decided to discuss today with you a few vision, ideas and plans that the URSM has for country Sint Maarten. Because we do believe that nowadays, at this particular moment, Sint Maarten does not have a direction that it's heading towards. There is no vision in government, there is no leadership, the people of the country are losing hope. People don't have a clue what this government is doing. But on the other side, URSM is preparing to make it happen that by the upcoming parliamentary election that we have a firm plan, evident plan ready to present to the people of Sint Maarten so they can make a correct choice what type of government they would like in the nearby future for Sint Maarten. And hopefully, seeing the situation that Sint Maarten is in, I hope that the elections will be sooner than later. Today I decided that I'm going to speak about the vision on healthcare for country Sint Maarten. And as you know, Sint Maarten became an autonomous constituent state on October 10, 2010 within the Kingdom of the Netherlands. The structure of the kingdom, laid down of course in the Charter of the Kingdom, devolves an authority to the local government for self-government and self-determination. Hence, Sint Maarten has the autonomy and freedom in preparing government systems, entities, institutions, and administrations to meet the needs, hope, and aspirations of the people of Sint Maarten. Knowing and realizing that how the things are going now, we do believe from the URSM that there is a big chance that we will be part of the next government of Sint Maarten. Actually, there is no doubt that we will be part of the upcoming new government of Sint Maarten after elections. And because we are convinced that that will be the case, the URSM established a committee, and a committee of health in this case, that is brainstorming on the vision, ideas for the healthcare for the nearby future for country Sint Maarten. The conception of this URSM committee healthcare is to establish the long-term development directives for the healthcare of country Sint Maarten, to define clearly the level of healthcare necessary to service Sint Maarten, and also to give incentives to create resources that would allow government to realize the ambitious healthcare goals within 10 to 15 years from now. The whole intention of the healthcare plan that the URSM is busy with is to contribute to the consolidation of an autonomous constituent state in which the pillars carrying the autonomy would be strong and the foundations of these pillars poured in a solid format. As I said, we are working on vision plans for the healthcare for Sint Maarten, and I decided today to elaborate a little on some of our vision plans that we have for the healthcare for country Sint Maarten. I will go through them step by step, depending on the time, of course, because we have a small hour to elaborate on all the vision, ideas, and plans that the URSM has. But we're going to just start and see how far we get with incentives and ideas to consolidate a responsible healthcare for country Sint Maarten. If the URSM comes in government, the first thing we think that we have to start with is to pay attention again to complete the new General Hospital project for country Sint Maarten. As you know, at this particular moment, there is a talk that they're busy with the construction of the new hospital, but if you observe the activities that is going on with the construction of this hospital, it's going at a very low pace. And I even believe that the way this construction is going related in time, it will become a financial nightmare for country Sint Maarten. The moment you have a national project, like for example the construction of a new hospital, it has the moment you decide that you're going to start the construction, it's pressing on a green button, and at that particular moment it has to be an activity of day and night, with concrete trucks driving in, driving out, big beam lights at night, because there is no time to lose, because in such big projects, time is money. And the way we are now observing the construction of this hospital, I do believe that time is being misused in a way that is going to cost the country, and actually our pocket being the ones paying premiums and also the ones paying tax. We are going to be, at the end of the day, the victims that are going to pay for this nightmare project the way it's going. The URSM does believe, of course, that we need a new hospital for the nation. We do believe that. But we do believe that we first have to look at the financial status that we have now to see if it's visible to continue in that context with the construction of the hospital, or if we have to reevaluate all the financiers of this project and even think about not the possibility of elevating the construction and financing to a shared responsibility in the kingdom. That is, of course, a big thing that I'm saying here, but I do not want this nation to go bankrupt on a project that has not adequately been guided to realize. And that's why I say I hope that the elections will be sooner than later, so the URSM can be part of the action plan to interfere in what is going on now with the construction of this new hospital, because you must not be a contractor, an engineer, to know and realize that the way now this hospital is being constructed is being a money-losing activity for country Sint Maarten. And we will have to reevaluate the status, the financial status of all the financiers that are going to contribute in this, see if still this is a realistic plan, and if not, to see, as I have proposed already, consider the possibility of elevating the construction and financing to a shared responsibility in the kingdom. It's a big statement I'm making, I'm realizing that too. But we are advocating a kingdom. We should not be in a relationship in the kingdom that the Netherlands is only the whole day putting conditions on us. If we choose to be in a kingdom, a relationship of equality, I do believe that the Netherlands also should have a shared responsibility in financing the healthcare of country Sint Maarten, because we are part of the kingdom, and in the charter stands that the healthcare of each country in the kingdom is a basic right, and we should do it in a way that we can offer all the countries in the kingdom a equivalent level of good health care. And the people of our country deserve that as much as those living in the Netherlands. So if we want to speak about a kingdom, let's show each other our good intention, and I would involve the Netherlands to participate also in a shared responsibility in the financing of the construction of the new hospital. What I do believe too is that we should create conditions for the development of medical tourism. There is, for example, in the Cayman Islands, there is a big institution now that is functioning next to the National Hospital of the Cayman Islands. And this private institution is offering also great care, and it's being developed in a way to service medical tourism. And I do believe that competition also in healthcare gives the necessary stimulus for people to step up the plate and monitor high quality care in a way that is going to serve all of us. Another point that the URSM thinks about that should be in a responsible way executed is the financing of the healthcare of country Sint Maarten. As you know, this government started the introduction of a financing model for the healthcare that at this particular moment is in cry. I can tell you there is now a deficit in the healthcare insurance that we call the ZV. It stands for the Dutch words ziekteverzekering, the ziektekostenverzekering. So there is a deficit in the ZV fund by the SZV, and there is also a deficit in the accident insurance OV, in Dutch de ongevallenverzekering. And there is also a deficit in the FZOG, That is the funds for the retired civil servants for healthcare. So it's a healthcare funds for the retired civil servants, the known FZOG. And as I said, the ZV fund, the OV fund, and also the FZOG fund are in deficit. And the deficit now is estimated to be around the 328 million Antillian guilders. At this particular moment, we are paying healthcare not from the ZV fund or from the OV fund. No, we are paying the healthcare through money that we transfer from the pension fund. And I think that is irresponsible to use pension fund money to finance the ZV, the sickness insurance, and the accident insurance for the people of country Sint Maarten. Ways to work on a more balanced funding of the healthcare is, for example, to increase the wage limit in a way that there is a higher income is also welcome to contribute in paying premiums in the SZV as such. They are working now on it to increase it from 67,000 guilders per year to all those owing till 120,000 guilders. So there is a significant increase in the adding of members that can contribute to the SZV funding for the healthcare financing for country Sint Maarten. And I think it's a good thing that we try to get as much people as possible in contributing in the healthcare funding of the country. The contribution towards the healthcare funds for employees in the public sector also should be more in line also with those in the private sector. We will have one of the other way to be serious in taking measures to make it more sustainable the financing of the healthcare of country Sint Maarten. The civil servant should at least have an own contribution to the ZV and OV of at least 4.2%, I think. And I think another portion that can contribute to the financing for the people of Sint Maarten for their healthcare is, for example, to consider the possibility of a tourist entry tax to co-finance the healthcare for the people of Sint Maarten. And actually, as it is by the best islands, Bonaire, Sint Eustatius, and Saba, we see also that mother country, the Netherlands, is contributing for the healthcare because they are part of the kingdom. But we as a country are also a part of the kingdom of the Netherlands. So I do believe that there should be in financing of healthcare for the people of Sint Maarten also a shared responsibility for the Netherlands in this relationship. The problem with the financing, the problem to create a sustainable financial system to finance the healthcare of country Sint Maarten depends on a few factors that is very, very difficult for Sint Maarten to adhere to. In general, if you talk about, for example, what has been discussed in the past, a general health insurance, or you name it, a national health insurance, for this to be successful in the format that it works in big countries is that those countries have to be rich countries. Sint Maarten is a poor country. People do believe, because they see a few mega yachts in Simpson Bay, that this country is a rich country. It's not the case. Sint Maarten is a poor country in development. Sint Maarten is not a rich country. So for a sustainable national health care insurance, you should be a rich country, and Sint Maarten is not. Further, the country that has a national health insurance must be a well-organized country. Sint Maarten is not a well-organized country. For a sustainable healthcare system, a national health insurance system in a country, you will have to have a low percentage of illegals. And we all know in Sint Maarten that we have a high percentage of illegals. And I even dare to say that I do believe that 20% to 25% of the community of Sint Maarten consists of illegals. Everybody talks about the population of 60,000 inhabitants in country Sint Maarten, Dutch side. I believe it's 80,000, and I believe that 20,000 of the 80,000 are illegals in this country. Once more, nothing against illegal persons, people in this country, because the illegals are contributing also on the labor market for the economy of Sint Maarten. But at the end of the day, we will have to organize our country in a way that we get a better control of the illegals in our community and try to diminish this percentage that is now, as I said, between the 20 and 25%. If you have a too high percentage of illegals, a national health insurance or a general health insurance is not going to work. You have to make sure also to have a low rate of undocumented. So be careful. If you have too many people undocumented and illegal, you're going to have a big problem, a big challenge with your national health insurance. We must not forget that Sint Maarten is also in a hurricane belt. One hurricane, as for example Irma, we had that example of Irma. One hurricane, it knocks down the whole economy. People lose their job. Once they lose their job, they cannot contribute to premiums for the insurance, and that means that health insurance, being a national health insurance, is not going to be sustainable anymore with the knockdown of one hurricane. So national health insurance are very vulnerable concepts in countries that are in a hurricane belt. And the second thing is that Sint Maarten is not a big country, but a very small populace. So we have to be careful with the effect of, for example, a nature disaster. Further, we have to have a well-organized border control. If you want to talk about the national health insurance, you will have to have a good organized border control because you have to have a good hold on your immigrants. Further, national health insurance have been proven to be functional in large populations, but Sint Maarten only consists of 60 to 80,000 people, and that is not large enough to have a sustainable national health insurance. One more thing that is a must is you must not have too much poverty in your country for the national health insurance to work. And in the case of Sint Maarten, and I said it many times already, the poverty rate of this community is too high. And the URSM knows the figures. That's why I'm so confident the way I'm bringing it to you, because the poverty rate now in Sint Maarten is average 29 to 30%. That is almost 1/3 of our populace lives under a poverty line, and I think that is unacceptable. National health insurance also works in continents, in big countries, as I said. The moment you apply a national health insurance on a small populace or on an isolated island, an island community, it's going to be very difficult to make this national health insurance sustainable for the country. So I spoke a lot already about the national health insurance. It's something that we have to look very careful to, and I do believe that there should be a shared responsibility in the kingdom concerning the co-financing of the costs of healthcare for a small community as Sint Maarten. Ladies and gentlemen, we're going to take a small break, and we'll be back in a few minutes, and then we will continue sharing some visions for the healthcare for country Sint Maarten to be executed on a short term. after the upcoming elections for country Sint Maarten. We will be back in a few minutes. Ladies and gentlemen, welcome to the second half of our radio program, You Are Sint Maarten. As you know, in this program today we do not have an invité with us, but I decided as a medical doctor to share some vision that the URSM has for the healthcare for Sint Maarten. And realizing, of course, that I'm a medical professional working for a while already in the healthcare of Sint Maarten, I do have some specific ideas, evident ideas, what should happen with the healthcare for country Sint Maarten and its people. I spoke a little about a few vision points in the beginning, and I'm going to continue giving some extra vision ideas that I have, that the URSM actually has for country Sint Maarten. And that's why I hope that the people will make a good choice to give the URSM the opportunity to be in government, in the next government, so we can govern with a vision, with a plan, instead of going in as we have been seeing that happening in the past, that political parties win an election, they form a coalition, they go in government, and they don't have a clue what they're going to do with the country. And the URSM wants to do it different. The URSM thinks about all the insufficiencies of the community, and that is the reason also that we established this healthcare committee. We have, of course, more than that. We have also the education committee. We have the neighborhood committee, just to tell you a few that we're actively busy with, because once we are in government, we want to hit the ground running, as we say. Coming back to vision points from the URSM towards healthcare, another thing that the URSM would like to pay attention to is actually not only to complete the general hospital for country Sint Maarten, but to establish a new state-of-the-art mental health care facility for country Sint Maarten. And I do believe that next of having a new state-of-the-art mental health care facility for country Sint Maarten, we also have to establish a medical psychiatric department in our new general hospital that we are constructing. I'm driving every day on the streets of Sint Maarten, and I see more and more psychiatric patients, mentally challenged young people on the street. It pains me because I look at them like they can be my kids too. And it's very painful to see that we are not reaching out to those psychiatric patients to get them from the street. They are becoming furniture of daily life on the street for us. And I find that unacceptable. And the URSM finds that unacceptable. And that is also the reason that we are paying close attention to make sure that we have a plan for a psychiatric department, a wing in the new hospital. That is for me an absolute must if the URSM is in office. And also that we work on a state-of-the-art mental health care facility for the country that is accessible for all inhabitants of Sint Maarten. I repeat, I find it unacceptable nowadays that we are even desensitized for what we're seeing on the streets, as if it's business as usual that we see all these mentally challenged persons walking on the street, cars passing by, looking at them as if they not even exist. And I think to myself, it can be my kids too. And I do believe I have the responsibility, we have the responsibility to take care of those mentally challenged persons in our community too. And that's why the URSM, the Unified Resilient Sint Maarten Movement, wants really to work on psychiatric health care for country Sint Maarten in a structural way that it really serves and helps the citizens of this country. Further, the URSM has a other idea about the registration of medical health professionals for country Sint Maarten. Until now we are copy-pasting a BIG, the big registration. That means that we have to adhere to the rules, regulations and the stipulations for healthcare professionals to work in Sint Maarten. I do believe that we should create our own medical health professional registry for country Sint Maarten, and that we should also deviate from only the Dutch market, but also try to find our medical professionals in our vicinity, in the Caribbean. I do believe that medical professionals that had an education in our surrounding area understand better the culture of our people, understand better our habits, and understand also better how people deal with diseases here compared to European countries. It's about the same disease, but it's about how people experience the disease, how they communicate about it, how they feel about it, what their expectations are from medical professionals. And those cultural things do have a significant contribution in the healing process. If the patient has the feeling that he is better understood by the medical professional, it's going to help him in the process of healing. And we from the URSM do believe that we have to start looking for medical professionals in our neighboring islands, in South America, in North America, but we have to try to stay close to our own Sint Maarten when we're looking for medical professionals. We are paying now approximately between the 35 million Antillian guilders to get health care from Colombia. If we ask now the same Colombian medical professionals to come work here, the law system will tell us that it's not possible to leave those professionals come to Sint Maarten to help the same patients that they do help in their own country, and that we even pay average 35 millions a year. I do believe this is incorrect. It is absurd, as I say. Why should we pay good professionals in Colombia for healthcare that they service us with in their country, and the moment we bring them in our country, the law states that they are not competent to execute their profession in country Sint Maarten. And that's why I believe that a young country Sint Maarten should assume its responsibility and try to create, with the assistance of the law, a great medical professional registry that we can determine ourselves who the doctors are that we want for this country. Further, we have to establish also the level of care that we want for this country. As I said, we are talking the whole day about healthcare. We are describing the fact that we are building a new hospital, but it's not about the building, it's about what we are going to sell in that building. It makes a difference if you're constructing a place that you think I'm going to do business with, but it depends, am I going to sell shoes in it, or am I going to sell clothing in it, or am I going to sell office supplies in it? So it's completely dependent on what you're going to sell in that building. And for us to sell something, we have to define first what we want to sell in that building. And in this case, with this national hospital that we're building, we should sit together and describe the level of health care that we want for country Sint Maarten. What do we exactly want to offer the people of Sint Maarten concerning health care? For example, do we want to have a neurosurgeon for the people of Sint Maarten? If yes, how many of them? What are they going to do in neurosurgery for country Sint Maarten? All that has to be defined. Do we want heart surgery? Do we want endovascular heart surgery only? Or do we want open heart surgery? these are really things that now that we are constructing the new General Hospital for Country Sint Maarten, that is the moment that these questions should be answered, because this is the moment to incorporate the vision in the structural construction of the new hospital. So it's time for the URSM to get in government, because we do have answers for those questions, and to be on time to contribute before finalization of this hospital. We will have to think also in the diversity of specialists that we want for Country Sint Maarten. And we have to think careful for each specialization if we want that to be represented in the new hospital. For example, the orthopedic surgery, the ENT specialist, the ear, nose and throat, eye specialist, neurosurgeon, oncologist for the cancer patients, a pathologist to look at the samples of the tissues to see if something is cancerous or not. Psychiatrist has and is still a challenge to have enough of them in Country Sint Maarten. We need more nephrologists on the island. We need more neurologists on the island. We need pulmonologists pertinent here on the island. And we need at least, I think, 3 pediatricians for the populace of Sint Maarten. And we need the presence, constant presence of plastic surgery and maxillofacial surgeons, those that operate fractures in the face, in your mouth, in your mandibula, in your jaw fractures. I do believe we need also maxillofacial surgeons for Country Sint Maarten. All those have now to be defined before we finalize this hospital, because each specialty has its special requirements. And now is the moment to build in all those facilities in the new structure that we are constructing. But you need knowledgeable people in government that can give direction and ideas and give actually incentives and knowing what they're talking about to make it happen for Country Sint Maarten. I do believe also that we should establish a stroke unit for our patients that unfortunately get a stroke, and we have to develop a stroke unit. Another thing is, I do believe that we will have to have a diabetic care unit in the hospital. If you see how many diabetic patients we have in Country Sint Maarten, I do believe that we will have to have a more structured, tailored care for the diabetic patients for Country Sint Maarten. What we need also here is also in the hospital a revalidation center for those that, for example, broke their legs, that need adequate physiotherapy and revalidation, that need to learn to walk again, that have the facility for all type of machineries to exercise with, so they can recatch their daily activities again. I do believe that we should look into the establishment of a revalidation center in our new hospital. And of course, we have to make more endorsement of home care programs to assist the elderly and the mentally and physically challenged citizens, that they can receive more support at home with nursing, with keeping the house clean, with their laundry, with cooking, with running the errands, and also with transportation, because the fact that they have a handicap does not mean that they are excluded from the society. No, we have to make sure that we keep everybody in inclusion in this community. What the URSM also believes in is subsidizing dental health care and the screening of your teeth, especially in the youth, in the preliminary education phase of life. I do believe that the teeth of the children of the youth of Sint Maarten are not getting enough dental attention. And I do believe in introducing a subsidized dental care for the children for County Sint Maarten to make sure that they have sound, healthy teeth that can guide them and help them with their eating in their life. And also we have to amplify, we have to make more bigger the facility for nursing home, because there are a lot of chronic sick people, and we have to make sure that once they are discharged from the hospital, sometimes their condition is too severe to go back home. And then we have to make sure that we have a capable institution that we have now in the White and Yellow Cross, but we have to work on it to make it expanded so we can have more facility for the group of patients that need chronic nursing care. The URSM has this at its heart, and we would like to have a great nursing care system for the people of Country Sint Maarten. Another thing that I think that we should work on is, for example, that there should be a free choice for family physicians for the people of Sint Maarten. Now it's about choosing a physician that you have to stick to for a period of time. We do believe that you have the freedom to choose for yourself anytime the family physician that you want in your country. And there should be more transparency in the registration of patients by family physicians in the SZ4 registry. These are administrative, small things that I do believe will contribute to a better health care if we also readjust them and pay closer attention to. What I do believe also is that the family physicians should be available after office hours and also in the weekends. Nowadays, when something happens in the community, somebody gets sick, everybody runs to the emergency room, overloading the emergency room. And I do believe that we have to organize the primary physician, family, house doctor care in a way that there is a on-call system after office hours and in the weekends, that you have a accessibility to family physician care after office hours and in the weekends. I think that is important for the continuity of good health care for the people of this nice country. This is something that the URSM will work on to make it happen for Country Sint Maarten. As we said, the URSM is not a party to destroy, to criticize. No, every time the URSM gets the opportunity, it will assist in contributing in a way that we are going to bring solution for our problems to make this Sint Maarten a better place for all of us. Further, we will have to organize also a better accessibility of the pharmacy care for the country. Sometimes it's a big issue for you to get your medications after 5 o'clock or in the weekends. And I do believe we should come with policies that we always have access to the pharmacies here on the island. So we have a continuity of 24 hours a day for the accessibility to medications once a doctor prescribes something after office hours or in the weekends. We from the URSM also believe, for example, in a on-call accessible dentistry care post for Sint Maarten. If you have, for example, a dental issue after office hours or in the weekends, I think it's a big problem to get a dentist to help you. And we will have to organize our dental care for the people of Sint Maarten in a way that it's accessible at the first place for everybody, and secondly, that it's also 24 hours a day accessible for the people. As you're realizing while I'm talking, we have a lot of great visions for country Sint Maarten. And further, I would like to say that we have also to see if we can redistribute the accessibility of healthcare for the country. That means make sure that in all communities in Sint Maarten there is good representation in, for example, family house doctor care, in dental health care, in psychiatry care, so in social workers for the different areas in the country. So we will have to pay attention that we give the significant good specialty care in all communities, that we have representation of family doctors, we have dentists in those neighborhoods, we have social workers, we have physiotherapy, that not everything is in one district and the other districts do not have those professionals to help them. That is something that the URSM also is working on. Further, we have for example, I was thinking to introduce the heel prick screening, what they call that, is actually to detect congenital abnormalities by the newborn. We can do with one blood sample standardly, we can detect a lot of abnormalities by the newborn, and I do believe that should become a necessity for country Sint Maarten, that standardly all kids get this blood test, and then at that particular moment a lot can be screened on congenital abnormalities that you get by birth. So in that way we can assure more quality of care for the small babies, screen them in advance, in the early stage, detect abnormalities and treat them on time adequately. As you know, I can continue because the URSM in its committee has a lot of items that we have put together in a vision for the healthcare of country Sint Maarten. And unfortunately, we are running out of time. But I hope I gave you a few items of the vision of the URSM concerning the healthcare on short and long term for country Sint Maarten. Ladies and gentlemen, I hope that you enjoyed my talk about the healthcare. As you know, I'm since 1999 the doctor here in Sint Maarten, the surgeon. So at least you get it from an insider, you get another approach concerning the future vision for country Sint Maarten. And you realize, of course, during my presentation, that the URSM is taking your future of your country at heart. We hope really out of our heart that the people of Sint Maarten will wake up and give knowledgeable people the opportunity and chance to govern their country for them. Ladies and gentlemen, we are ending now because time is running on us. I want to thank you to be with us in this program, and I'm looking forward to have you back in our weekly radio program, You Are Sint Maarten, on 94.7 FM, next week Wednesday from 6 to 7 p.m. I wish you a pleasant evening.